Attention everybody, the views and opinions expressed on this show are not necessarily those of Acts Ministry, Acts Media Group, and or their affiliate and subordinate ministries and or nonprofits. So here he is today. Same day as every day. It's crime time with Dr. Steve Albrecht. Take it away, Steve.
Thanks, Producer Matt. Welcome to Crime Time. This is Crime Time podcast episode 56. I'm Dr. Steve Albrecht, joining you from the Acts Media Group studios in Springfield, Missouri. For this hour, I'll be talking with Ryan Dowd. Ryan's the executive director of Hesed House, one of the biggest homeless shelters in Illinois. He's also an attorney and the author of a great book, 2018 book, called The Librarian's Guide to Homelessness, an empathy-driven approach to solving problems, preventing conflict, and serving everyone. We'll talk about why the book is not only important if you work in a library for your interactions with homeless people, but also if you have any kind of public contact job at all, the book is useful for you because it talks about how you deal with the homeless in any variety of interactions you may have with them in the field, in the street, over the counter. They come into your facility. Even if you run a private sector business, a retail establishment where you have the homeless there as well. A lot of the things in Ryan's book are useful tips and ideas for how we deal with this population, which can be troubling and troublesome. So thanks for listening to Crime Time, where we talk about crime and crooks and cops and personal security. We'll talk about some dangerous people and lots of heroes. We'll mention a few stupid crooks. And most importantly, I'll talk about what you can do to keep yourself and your family safe from crime and violence. As always, you need to be vigilant at home and in your neighborhood and in your community, at school, at work, and even on the road. This show exists to make you feel more empowered, more secure, and more educated on security issues and the criminal justice system. As background, I work for the San Diego Police Department for 15 years as a patrol officer, reserve sergeant, and domestic violence investigator. I now work as a training consultant, and I teach training workshops focusing on human resources, employee coaching, workplace violence prevention, and security issues at work. I've written 23 books on business, workplace violence, police subjects, and guns, all of which you can find on Amazon. You can always reach me at my crimetimeradio.com website, send me an email, connect with me on LinkedIn, and follow me on Twitter. You can find past episodes of the show on soundcloud.com, and the new ones always post on YouTube as we do them. So my friend Ryan Dowd, I'm going to paraphrase some things that I know from him. He said, being homeless in America is boring, dangerous, lonely, scary, and does horrible things to the person's self-esteem. Let's talk to Ryan about his work at the Hesed House Homeless Shelter and what he and his staff do on a daily basis to provide this ever-growing population, not only in Illinois, but in this country, with services and support. Hi, Ryan.
Morning.
That was a long conversation to say that I really appreciate your book and the work that you do, and I have said to you many times in our conversations, I wish I had read your book on homelessness in the library before I wrote my book on library security. There were so many things I should have put in my book that you covered in yours, and that's why yours is such a useful addendum to the things that I talk about in my training programs for librarians. So besides the work that you do with Hesed House, you also would it be safe to call you a technical consultant on the movie The Public?
Kind of. So, yes, I was involved with a Emilio Estevez movie about libraries and homelessness. I came in after the movie was already made, though, so I don't know that technical consultant would be appropriate. I helped with we did a national tour to promote the movie.
So the movie The Public 2018 was a movie based on homelessness in a Cincinnati library, written and directed by Emilio Estevez, who acted in the film along with Alec Baldwin, Gabrielle Union, and Christian Slater. So, Ryan, one of the things that I've always been fascinated by your life story is that you got over to Hesed House at like age 13 as a volunteer.
Yeah, before I answer that, let me quickly apologize. I am actually sitting in my basement in quarantine with my cough, waiting for my COVID results. So I'm going to try really hard not to cough into the mic, but if I do, I apologize.
I already have an allergy cough, so I beat you to the punch there. I'm going to be hacking away probably as we talk as well.
Fantastic. Well, this will be just completely inaudible then to hear us between our coughing. So, yes. So when I was 13, I was in my Sunday school class at church, and they passed around a sign-up sheet to volunteer at the local shelter, Hesed House. And I didn't know what it was. I knew nothing about it. I really didn't know what the sign-up sheet was for. But I did realize that every single girl in class signed up and not a single boy. And I really liked those odds. And so first time I went to a homeless shelter, I was literally trying to get a date.
So you thought a homeless shelter would be a good place to pick up chicks, huh?
I did. At least teenage chicks from my Sunday school class. But when I got there, like all of a sudden, the girls there just didn't matter, because it was very different than my kind of suburban middle class upbringing. And there were some people with mental health issues talking to themselves, and other people that didn't have all their teeth necessarily because of lack of access to dental care, and on and on and on. And there was something about it that I liked it there. And as a 13-year-old, you can't tell people that you like it at the local homeless shelter. But I did. And so I kept volunteering in junior high, in high school, in college. And then in college, I joined the staff, and kind of haven't looked back since.
So Hesed House is about an hour west of Chicago in Aurora?
Correct, yes. In Illinois' second largest city, Aurora.
And so when you look at the work that you're doing today, I mean, you have been, so your relationship with Hesed House is 25 plus years, something like that? Longer?
Longer, I guess. Yeah.
And so
almost 30.
In that time span, you've seen so much, and you're still there, so you have hope. And we look at this subject of homelessness in the United States, and I think people look at California with 150,000 homeless people, and they look at what's going on in California in terms of the failures of government in a lot of respects, especially in Los Angeles and San Francisco, to get much of a handle around the issue. And I think they feel pessimistic about it, hopeless about the issue and solutions. What's your sense as you look back over 30 years?
So there's reason for hope, and then there's reason for despair, honestly. So here's the reason for hope. Those of us who do this for a living, we're getting better at it every year. And the biggest change in the quote-unquote homelessness industry is that in the 80s and 90s, we tended to do things that made sense. So like transitional housing, that makes sense. Help a person, lift them up, give them some bootstraps and help them, get themselves back to transitioning back to society. Now, as an industry, we're doing a better job of doing what works, even if it doesn't make sense, and not doing what makes sense if it doesn't work. And so using the data to drive what we do. So, for example, years of research has discovered that transitional housing, as a general rule, is not very effective. It does a really good job of helping people get back on their feet again who would have already gotten back on their feet again even if you didn't do anything. And it does a really lousy job of helping people get back on their feet again who really genuinely need that help. So because of that,
would you say the people that are best suited for transitional housing don't have substance abuse or mental health issues that kind of paralyze them?
Yeah, so people that do well in transitional housing don't have significant issues, and they would have done well anywhere. They would have done well in an emergency shelter. They would have done well, sleeping in their car for a couple of days till they get back on their feet again. They're going to do well no matter what. And the people that really need the intensive, expensive model of transitional housing, they tended not to do very well in it because of this kind of accountability model of, you got to pull yourself up by your bootstraps and not make any mistakes. And people that need that intensive care, they slip up sometimes, and the model just wasn't very accommodating of that. So as a general, we're getting better at, again, following the data and doing what works, even if it doesn't meet our ideological notions of what we should be doing. And that's exciting. What's less exciting is the idea that homelessness is not the consequence of one system failure. It's the consequence of a lot of system failures. So we have less affordable housing today than we did 40 years ago in this country. That adds to homelessness. We've dismantled a lot of our mental health systems. That adds to homelessness. The war on drugs has added to homelessness. I mean, there's just so many systems that add homelessness, and sort of to backpedal it, to fix it, it'll take a lot of systems being fixed, and there's not kind of one solution, and that's frustrating.
So you look at folks in your population that we would define as having poly problems, which is multiple issues, right? Substance abuse is an issue, and mental health, issues that they have that are not treated for, or they're poorly treated, or under medicated, or they don't take their medication as directed, or they switch over to drugs and alcohol to sort of calm the demons that's going on. Can you? And I look at this number all the time, and it fluctuates. Can you, from your research and your experience, can you say this percentage of the homeless population has a drug or alcohol problem at a percentage level you can define? This percentage of the homeless population has a mental health issue in a number you can define, or do we not know? Is it because we ask questions of that population they don't self-admit, or do we not have good research on what kind of the actual percentages are of that population?
Yeah, the data is hard to judge its accuracy, particularly around mental health issues, because a lot of it is self-disclosure. And in my experience, people who struggle with addiction are quite oftentimes very open about that, but people who struggle with mental health issues don't disclose it because the stigma against mental health is actually stronger than the stigma against addiction. Either way, though, I don't know. That's not exactly the right question. And here's why. It misses a fundamental component of homelessness. So take the homelessness population and let's divide them into three groups. People who are homeless for 2 weeks or less, people who are homeless for 2 weeks to 1 year, and people who are homeless for over a year. If you break it down that way, in our shelter, half the people we serve, 50% of the people we serve, will be back on their feet again within 2 weeks. There's no major mental health issues, there's no substance abuse issues, they had some sort of economic crisis. They fell into homelessness, they work their butts off, they get back on their feet again, and they will very, very rarely become homeless again. I think something like 7% of Americans will be homeless at some point in their life, and most of them will be homeless for a very, very short period of time. Now, the next group, that's 2 weeks to 1 year, that's going to be about another 40%. This population typically has one major life barrier. So there's a mental health issue or a substance abuse issue or a legal issue or a medical issue or some sort of employability issue, but there's typically one major issue. It takes about a year to work through that, get back on your feet again. What that means is that about 90% of the homeless population will be back on their feet again within 1 year. And that's fantastic. But that leaves the last 10%. The last 10% is what the federal government calls chronic homelessness. Chronic homelessness is a year or longer. We have a gentleman in our shelter who moved into our shelter at some point during the Reagan administration. We don't know which year of the Reagan administration because he doesn't remember and our records don't go back that far.
Wow.
But he is definitely chronically homeless.
Right.
Now, the chronically homeless population typically has multiple life barriers. There's almost always a mental health issue, oftentimes substance use layered on top of that, legal issues on top of that, medical issues on top of that, and on top of that, oftentimes they're just unemployable because of all these different areas. Now, again, if you break down the incident rate of mental health and substance abuse by those three populations, what you find is the first group has almost none, the second group has a little bit, and the third group is almost 100%.
Right.
Now, if you realize that as a country, solving all of homelessness is overwhelming, instead say, let's just look at that last 10%. Because that last 10% is a manageable number. And if we can get them into housing, if we can get them help, we can dramatically change the face of homelessness. Because if I get somebody who's going to be homeless for 2 weeks and I put a ton of effort into it and I can reduce that down to a week, well then great, I just saved them a week of homelessness. But if I can take somebody who's going to be homeless for 25 years and reduce that down to 10 years, not only have I just changed the trajectory of this person's life, I've also changed the trajectory of that community. And this is an area where we're, as a country, starting to get better. And the result, the conclusion here is that permanent supportive housing is the only answer for the chronically homeless population. Basically, you do what's on its face super, super un-American. You take somebody who's been homeless for 10 years, and you rent them an apartment, and you pay for it 100%, and you pay for the utilities, and you send a case manager out to them, once a week, once a day, whatever it takes, and you keep them housed as long as humanly possible, which hopefully is, they live a long life and they pass away. And you don't make any effort whatsoever to get them back on their feet again. And why it's so incredibly un-American that, you're not trying to help the person get better. You're not trying to get them independent. You're just trying to keep them housed. But here's where it becomes genius, is that the cost of a chronically homeless person being homeless is dramatically greater than the cost of an apartment and a case manager.
Sure.
And what the research shows is that if you take somebody who's been on the streets for 10 years struggling with mental health, they might cost, I'm going to make up some numbers here because it varies by community, but they might cost society $60,000 a year in police time, in fire time, in emergency room time, in shelter costs. That same person, you drop, let's call it, 15, 20 grand on case management and a social worker, and now they might go down to like $10,000 in resources on police, fire, emergency rooms, et cetera. And you actually have a net savings. And so it's one of those really cool areas where solving homelessness is dramatically cheaper than managing homelessness or even ignoring homelessness.
And then
but only for this 10%.
Yeah, and then the model you talk about, we get diminishing costs for them as they stabilize and get into a normal life over the span of years, where they say we're not spending money on them for healthcare, we're not spending money on them for emergency room runs. I think you and I have talked about this case before. This was a piece I read in the New Yorker many years ago where they were talking about a $1 million patient in Washoe County, Nevada, which is where Reno is. And
$1 million Murray?
Yeah, was that who it was? I mean, the guy had, head injuries and a fractured skull and a broken leg and unmanageable diabetes, et cetera, et cetera. And I mean, sad to say, when he was a police issue, he was a fire and paramedic issue, he was a mental health issue. When he passed away, it was like everybody in the county got a pay raise because he was just so expensive in what he was doing. And the model you're talking about is actually an intervention model, which is we're not throwing, good money after bad. We're actually trying to break that cycle.
Exactly. And it's super exciting, but you have to let go of your preconceived notions of what we should be doing and look at what actually works. So what we should be doing is holding that guy accountable and, trying to get him back on his feet again. It just doesn't work. What does work is let's just get him some housing and stabilize his life so he's not spending so much time with cops and paramedics and emergency rooms.
When people look at homeless people in the street, and this is so powerful you have a website called homelesslibrary.com where you provide training to librarians, and you talk about this in your book. But your video is so powerful where you talk about how we look down physically and literally and in our interactions with homeless people as we walk by or drive by. I mean, one of the things that you said, to me in our conversations over the years really changed my perspective of homeless people is when I see them standing on the street corner, I make eye contact. I wave hello from the car. If I have a bottle of water and I can give them that, I'll do that. If I have a bag of dog biscuits, I'll give them some stuff for their dog. But this idea that we sit in our cars or we walk by and we don't make eye contact with that population and we try to avoid interacting with them. And you talk so powerfully about what it does to a person's self-esteem when that is the perspective that the public has as they don't see you as a human.
Yeah, it's incredibly dehumanizing where you're literally being treated like a bag of trash, where if you're sitting on the ground, people are literally stepping over you, stepping around and trying to avoid looking at you. It's incredibly dehumanizing. And when we take away someone's humanity, we shouldn't be surprised if they are a little less human after that, and we ourselves too. And so one of the best things you can do for someone who's really struggling is just to treat them like a human being, because when you get treated like a human being, when you start to have a little sense of self-worth, some things start to change. Like maybe you do get sober. Maybe you do have the courage to go get a job. Maybe you make the decision to show up for that counseling appointment that you maybe didn't do if you're just sitting around feeling like garbage because the world's treating you like garbage.
So what do you say to people when they're in that quandary of help for the homeless population, which is, the question you always face in your work, which is, well, if I give these people money, they'll just spend it on drugs or cigarettes or beer or whatever, versus we give money to groups like Hesed House. You can go to hesedhouse.org to donate to Ryan's organization if you want. Good idea. But what do you say to people in that sort of quandary? They feel like they want to help, but they don't want to give directly to somebody that they think, is going to waste it on booze and cigarettes.
Yeah, so I actually don't give to panhandlers. There's generally speaking a lot of free food in this country, and so generally speaking, if you're panhandling, as a general rule, and there's exceptions, as a general rule, you don't need to panhandle for food. So what does it get spent on? Maybe it gets spent on good stuff. Maybe it doesn't get spent on good stuff. I don't know. But I as a rule, don't give money to panhandlers. What I do give is far more valuable and far more costly to me, and that is I say good morning. I make eye contact. And it's more beneficial because, again, it helps the person with their sense of humanity and dignity. And why it's more expensive for me is that it pretty much guarantees that I'm going to get aggressively panhandled for the next 2 blocks, because I've made that eye contact so the person's going to think that I'm going to be a donor. And I explain, look, hey, not today, or I don't have any cash on me or whatever, but you have a fantastic day. And I try to keep that interaction pleasant, even if I don't. And again, I don't give money.
So when you look at homelessness in California, where I came from, and I worked with that population a lot in California and San Diego when I was a cop, and it's funny how the language we use, the semantic discussion of homeless in San Diego police parlance, we always called them transients. So, that was a phrase the dispatchers used on the air. Say there's two transients, in a laundromat bothering people, and we'd go over and deal with the issue. And so it's funny that, when we were kids, and maybe our grandparents' generation, they were bums and hobos, and then transients became sort of the word of art. And now you and I had this discussion where we've talked about the political correctness of identifying homeless people as people experiencing homelessness, and you've said to me, which I applaud your bravery, is that's not a phrase that's used in your industry.
Yeah, it's actually very rare. And there's changing a little bit. They're very rare to find people who work in homeless contexts that use the super people first language of individuals experiencing homelessness. It tends to be those of us on the front line. The language, language matters, but language is also not the end all be all. And so, I would rather focus my time on making sure people get treated with dignity and get food and get job training and get the services they need over making my crusade about language.
So
I do think, though, that I'll go the exact opposite direction in the sense that I think the word transient in a police setting is an interesting choice because what it implies is that the word transient implies the person's not from around here. And it allows the police department to view it as, this is another town's problem spilled into my community, versus viewing that person as a member of the community. And so, language is not the end all be all, but language also has the ability to shape our perceptions if we're not too careful. So it's, it goes both ways.
So if we talk about California for a second. Let's pick on California because I like to. Other than my parents still being in San Diego, I don't like to go back there. If one of the things that if you have 110 cities in Los Angeles County, and each of them have their own perspective, either their own PD or their own the LA Sheriff's Department, and it's sort of a move over 2 blocks and you're in another city's problem. And I've seen that, which is, the cops or the sheriffs will sort of shove somebody across the city lines to a park or somewhere, which is, camp out over here, then you're not this city's problem. So, there's that sort of kick the can down the road perspective. But when you look at California from where you sit in Illinois, and the homeless population is 150,000 plus, and San Francisco and Los Angeles have some of the worst. What sense do you get, without getting into the politics of it, but just in terms of the leadership failures in California? What has California not done that they should have done to address the population that they have, this huge population?
So one of the factors in California is just the cost of housing. You look at the average or median house in San Francisco is something like $1.2 million or something ridiculous like that. That leaves zero room for people that are on the lower side of the socioeconomic ladder, and so that's just a factor there that has to be reckoned with. On a broader level, though, when you're dealing with homelessness on that scale, it's almost not the same phenomenon that we're talking about in other areas. So, the incident rate of homelessness in Illinois is dramatically lower than in California, and there are other states that are even lower than Illinois. And so it's not just a difference in degrees; it's a difference almost in qualitative issue that the strategies might not just be more of what everybody else is doing. They might have to be entirely different, particularly when one of the contributing factors is again, skyrocketing cost of housing. I don't have the answer. If I did have the answer, I'd be going around the country giving speeches, making gazillions of dollars. But it is going to require a creativity, a long-term commitment, and a commitment to getting data and following the data that it's just going to have to be on a higher level than we're doing right now in particularly the whole West Coast. It's just the homelessness is just a different phenomenon than what you see in most of the rest of the country.
So don't you think that people like to dismiss California's homelessness issue as well? It's because the weather's nice. People go there because it's warm. Well, you've been to San Francisco. It's not warm there, and it's cold in California like it gets cold everywhere else. So that's sort of a cop out that I think people say. Well, there's just an exodus there because the weather's warm and you can sleep on the beach and things like that. But you're right about the cost of housing. I think in San Diego, the median house price just passed around like $600,000 or $650,000 or something enormous.
Yeah.
My parents paid $27,000 for their house in 1968 there, and So when you think about, those obstacles are just seemingly insurmountable, but isn't there also a failure from what you've been talking about to really look at the cost of doing things on a grand scale, which we can do. They have the money in California to mass housing for people, but they just sort of either kick the problem down the road or put their finger in whatever leaking pipe they have at that particular moment that they're dealing with, and there's no sort of overarching plan. There's some czar in Los Angeles County that was in charge of homelessness, and his office, and this is an LA Times review of this, his office spent $100 and something million and said we basically accomplished nothing.
Yeah, it's a complicated issue. And so, I want to cast stones and be like, hey, they could do a better job, and I'm sure they could do a better job. At the same time, there has to be some grace for trying stuff that doesn't work, because if we're not willing to try stuff that doesn't work, we're never going to figure out what does work. And so, $100 million, that stinks if that's true. But if they learn something from it and they're better tomorrow than they were today, it doesn't have to have been in vain. Now, if they didn't learn anything from it, then shame on them. But there's got to be. We have to have a long-term strategy. Yes, we need to solve it for today, but the problem is so large and so multifaceted that if we don't take a long-range approach of getting better every year, we don't have a prayer of coming close to solving this.
So people in the community that walk down the street or in a downtown neighborhood or come across the homeless in some environment where there's close interaction are sometimes fearful of them. And it's and you and I have seen, you certainly more than I, but have seen the schizophrenic homeless individual who's out of touch with reality and psychotic and sort of ranting, and that frightens a lot of people, obviously. But I think also there's a generalization that people make where there are a lot of homeless people on the street are therefore, quote, scary and dangerous. What's your experience?
Yeah, so you take any stranger, and there was obviously some sort of chance that they could be dangerous to you. The vast majority of homeless folks are not dangerous at all, and they're particularly not dangerous if you don't corner them and make them feel threatened. And so, are some percentage? Yes, but some percentage of all strangers can be dangerous. What sets homelessness apart is that the gap between someone who's scary and or what percentage of people are scary and what percentage of people are truly dangerous is massive.
Right.
In that, you and I could be walking down the streets of Aurora, Illinois, and you see a guy and you're like, oh, dude, that is a sketchy looking dude. And I'm like, no, that's John. John's is just an out of work mechanic who just dotes over his granddaughter. But you wouldn't know that from looking at him in his older, dirty coat and, long beard and whatnot. So I guess the starting place for me is that the vast majority of individuals who are homeless are not dangerous at all. And taking it a step further in that, treating people with dignity and respect is oftentimes the number one guarantee that someone's not dangerous. And that, if you're a jerk or you cuss someone out or you throw a beer can at someone who might not have been dangerous to you before might be dangerous now.
Right.
If you insult somebody who wasn't dangerous, they might be dangerous now. And that's not just homelessness. And yet we have this notion that it's okay to treat homeless people poorly, which not only does them a disservice, but are we surprised then when sometimes there's a backlash that's a little scary? And, again, you treat people poorly, and you shouldn't be surprised by the outcomes. So
in your library videos, the things that you have homelesslibrary.com for your library work, one of the things that you talk about, which I think is so insightful, is the things I kind of mentioned in the opening, which is homelessness is boring, it's dangerous, it's lonely, it's scary, and we talked about the self-esteem issues. So kind of go through this. So homelessness is boring, homelessness is dangerous to the person. We know about sexual assault of homeless children and women for sure, and even men. But talk about homelessness being boring, dangerous, etc.
So boring is just, it's the and this particularly relates to libraries, and that I don't know how it's boring to be homeless. That there's, if you live in a shelter, there might be a TV, but you don't get to pick what's on the TV. If there's books, you don't get to pick what the books are. There's a lot of downtime, a lot of time spent just kind of by yourself and whatnot. And so a library is just kind of an antidote to that, and that, there's books and there's DVDs and there's, programming and whatnot. And so in many ways, libraries are a respite from being homeless. The dangerous, I think, is a little more important in the sense that we tend to think of the danger that homeless people pose to society. Actually, though, society poses a much greater danger than the other way around. In my experience, any male who's been homeless for over a year has probably had somebody try to mug him or beat him up. Any woman who's been homeless over 2 years probably has had somebody try to sexually assault her. There is an enormous amount of violence and danger perpetrated against individuals while they're homeless. It's dangerous to be homeless. If you sleep somewhere where you don't have a locking door behind you, it's dangerous. If you have to walk in sketchy parts of town at night because you can't afford a cab, and so you're walking through parts of town to get to the shelter, it's dangerous. And the consequence is that there is just an enormous amount of violence perpetrated against homeless individuals. And thus what you oftentimes get is a lot of PTSD because people have been attacked so many times. And oftentimes it's not ordinary PTSD, it's actually CPTSD, complex post-traumatic stress disorder, which is layers upon layers upon layers of trauma versus a singular incident. And the consequences for the person are dramatically worse than ordinary PTSD.
So you raise a point which I think people also don't understand, who don't understand not only the criminal population, but the homeless population as well, which is a lot of crooks come from a trauma-infused, trauma-informed background, whatever language you want to use, but they grew up in trauma. And homeless people as well have had a traumatic experience, a series of traumatic experience from, alcoholic parents to sexual abuse to child abuse. There's some fracture, and you and I have talked about this at length, in some fracture of the family relationships for a lot of these people, that they don't have the support systems that you and I have. So talk about, from your experience, how you see so much of trauma as being a reason for some people's behavior.
So the missing link with trauma is the brain, the neural basis behind it. Because, if we look at something like, oh, you had a rough childhood, suck it up, kid, you'll get over it, and we've all had our struggles. That misses the component that a person's brain actually gets changed by traumatic trauma. And a couple of things happen. The prefrontal cortex, which is the part of your brain that kind of regulates your emotion, keeps you calm, allows you to think deep thoughts and think through stuff, it actually gets damaged by trauma. There's actually cellular death. That part of the brain actually shrinks. And so you have less control over your emotions because the part of your brain that controls your emotions is literally damaged. Conversely, the part of your brain that does fight or flight, the amygdala, actually physically grows, and it becomes much more active. And the consequence is that people who have experienced trauma, particularly childhood trauma, they spend a much greater percentage of their life thereafter in fight or flight mode. And they have a harder time regulating their emotion, harder time calming themselves down, harder time not acting impulsively. And none of this because they're a bad person, none of this because they're a jerk, none of this because they're drama prone, but because their brain has actually been changed by the trauma in ways that makes them basically feel like they're fighting for their existence even when they're not. And consequently, sometimes people will, go off or lose their temper in a situation that doesn't feel like it warrants it, until you recognize that their amygdala has completely hijacked their brain at that point. And once you understand the brain science, it's a lot easier to understand, empathize, and quite honestly, to work with somebody who's experienced a lot of trauma.
So if you go back to the idea that it's dangerous to be homeless and the sense of sleeping on the street or in a bad part of town, there's to go back to the sort of hormonal, emotional brain piece, there's a hypervigilance that they engage in. And think about it for yourself. You say, I have to take care of I have to watch my back while I sleep. How hard can that be to do? So that hypervigilance is really tough. But I think what I'm seeing, at least in my library work, and I'm sure you see it as well, is we're having more conversations about trauma-infused, trauma-informed, trauma-victimized, whatever language you want to use, people that come into the library, whether they're homeless or not. And we're seeing more discussions, especially in my training and conversations with them about empathy and patience and like you said, some knowledge, therefore, that says this person's acting out in ways that are much deeper than what we see on its face. What have you seen in your library work that's kind of moving towards a more of an understanding of the trauma background of some of the patrons coming in?
Yeah, I mean, when I do trainings, I spend a lot of time talking about trauma and not just trauma, but the deeper insights into understanding someone whose world is not like yours. And if I can kind of go on a tangent here, we tend to think of that the key to empathizing with somebody is to find and appreciate all the ways that they're similar to you. So, we're both from Chicago, so that's a similarity. I can empathize better with that person, and we're both, football fans or Bears fans. Okay, that's a point of similarity. But it turns out though that similarities are not the way to develop empathy for somebody. It's actually appreciating and understanding the differences between you and that person. That is the key to empathy. Picture it this way. So I'm a 42-year-old bald white guy who works in a homeless shelter outside of Chicago.
I still like you, though. I mean, you're still a good guy. I still like you.
Well, thank you. If I find another 42-year-old bald white guy who lives in the Chicagoland area and works in a homeless shelter, I'm not going to have to work too hard to imagine how that person feels about different things and how they look at the world and whatnot, because their world's pretty darn similar to mine. But if I'm talking to a 90-year-old Guatemalan immigrant struggling with PTSD who's HIV positive and an amputee, that person's world is fundamentally different than my own. And if I assume that they look at the world the same way I do, that they communicate the same way I do, that they have the same values, that they care about the same things I do, I'm going to be wrong a lot of the time because I'm imposing my world as if their world is the same as my world, and it's not. And when you look at individuals who are homeless, there's a lot of those differences, and the differences might be trauma. So if you've not experienced trauma and you're talking to somebody who's experienced a lot of trauma, their amygdala does not function the same way yours does. Their prefrontal cortex does not function the same way theirs does. But it's also further than that. Communication style. Individuals raised in poverty tend to have a slightly different communication style from individuals raised in the middle class. And the short version of this is that individuals raised in poverty tend to communicate in ways normally when they're not upset that to a middle class person looks like they're about to lose their stuff. And so you get this middle class professional person being terrified by the poor person who's not actually all that upset. And the difference is they just communicate slightly differently. And if you don't appreciate, if you think everybody's exactly like you, when people behave differently than you, it's terrifying. But once you start to appreciate and understand those differences between you and other people who've not had the same background as you, all of a sudden your ability to empathize, your ability to work with them, your ability to not be terrified goes up dramatically.
One of the things that you've said in your trainings, which I found just so amazing and insightful from your perspective, is your sense that a lot of your population that you deal with has autism, and they're somewhere on the autism spectrum, and we're not used to dealing with people in that population that autism has a variety of ways that it manifests, but part of it is inability to make eye contact and have good social skills, and also that they don't learn from the previous social errors that they made, and they keep repeating their same kind of behaviors over and over again. So talk about that. That seems like a shadow issue to me, that this autism piece.
So autism is, and I forget the exact numbers. I used to know this off the top of my head, but I forget it. But autism amongst the homeless population is dramatically higher than amongst the general population. So I'm going to make these numbers up. Let's say it's 5% of the general population, and it's 25% or 30% of the homeless population. Again, I don't remember the exact numbers, but it's dramatically higher. And oftentimes in the homeless population, it's undiagnosed autism, and so you don't know, and the person doesn't necessarily know that they're on the spectrum, and so that can create an enormous amount of unnecessary conflict when you like, to your point about eye contact, you read their lack of eye contact as disrespect, but it's actually not disrespect, it's autism.
Right.
And so again, if you don't appreciate and understand the differences between yourself and someone else, it creates an enormous amount of unnecessary conflict.
So do you think social workers are up to speed on that piece of the puzzle, the autism puzzle with that population? Do you think they know that as well as you do?
No. It's the research on homelessness and autism is less than 5 years old, and so it's not out there in the general population. There's a lot of things like that where we're discovering. So traumatic brain injury, I think, is the most recent study puts it at about 53% of homeless individuals have experienced traumatic brain injury. Like, that's not the NFL, but it's coming close. It probably, like, the NFL is probably the only group of people that has a higher incident rate of traumatic brain injury than the homeless population.
And so
traumatic brain injury changes people. Like they become more impulsive. They have a harder, like oftentimes they lose that filter on what they say. So they say stuff that's offensive, not because they're trying to be jerks, but because they've got brain damage.
Yeah, and the way the traumatic brain injury comes in is in such a wide variety. It could be child abuse. It could be accidents as a kid. It could be military, injuries. There's just so many ways that could manifest itself. Take us through. We have about, 5 minutes or so left. Take us through a typical day for a homeless person at Hesed House, and it's hesedhouse.org, by the way, to make a donation.
Yeah, Hesed, only one S, by the way, if you're looking for it, HESED. So a typical day is going to be, generally speaking, we get people up fairly early because, we've got to get cleaned up, we've got to get ready for breakfast, and so they're going to be up at 5 or 6 o'clock, take a shower, probably waiting in line to take a shower. If they waited too long, the water is going to be cold because the hot water heater can't keep up with the number of people we have. Have breakfast, and then typically we would shut down between 7 a.m. and 9 a.m., so they've got to go find somewhere else to be.
Right.
Maybe the library, maybe art sitting outside in our property. We open back up again at 9, so they can come in, sit down, watch TV, have lunch. Close back down again at 3 o'clock. Again, got to go outside, find somewhere to be. Reopen back up at 7 o'clock, have dinner, maybe play some cards, watch some TV, and then go to bed in a room with, our men's room can hold 88 people, at least pre-COVID it could. And so sleeping in a room with 88 people, about a third of whom are snoring at any point in time. It's not going to be particularly great quality sleep just because of the volume of snoring and coughing and people getting up to go to the bathroom. And that's another piece that I think people miss is that most homeless folks are sleep deprived.
Right.
And, I don't function at my best when I'm sleep deprived. And so I don't know why we would expect homeless people to.
And if you look at your population, what's the census in your facility right now?
So pre-COVID, we were at 250 on a crowded night.
Wow.
And then COVID, the regulations took us down, the shelter capacity down to like 106 to get that social distancing. So we had to open up a second shelter. We own a warehouse, and we basically just threw tents up in the warehouse. And now we're in the process of adding, HVAC units and bathrooms and whatnot to try to get through this winter. But when we're all said and done building the new shelter, we'll have a capacity of about 260, which basically gets us back to where we were pre-COVID.
And when will the new shelter be online?
So it's using CARES Act money, so it has to be online by December 30th.
Oh, wow. Okay. So
yeah,
people,
it's a fast and furious.
People can donate to you at hesedhouse.org. And what do I suggest to people that have kindness in their hearts, that are empathic and want to help the homeless advocacy groups that are in their particular communities? What's the best way to? Is it volunteer? Is it what besides just donate? What do you suggest to people who want to do something?
Yeah, COVID changes a little bit, but in general, volunteering is fantastic because volunteering gets you kind of in those circles of people who deal with this, but it starts to break down the homelessness as an issue and there starts to be faces and names behind it. So, instead of just thinking of homelessness, it's Joan and Dave and Sally and Sue and Terrell and whomever. And once you start to, person the issue is what activists would call this, your whole perspective on things starts to change. And so volunteering is just a great way to really engage more deeply and figure out how best you can additionally help.
So, Ryan, let's give some plugs to you. You're the author of The Librarian's Guide to Homelessness, an empathy-driven approach to solving problems, preventing conflict. I coughed through the plug. Preventing conflict and serving everyone. You're also, people can reach you in the library world at homelesslibrary.com, hesedhouse.org for folks that want to make a donation to you and to the organization.
And for people that are not librarians, homelesstraining.com is where we do the trainings for non-libraries.
Okay, good. So that's retail and other government agencies and things that would also benefit from your work. You've got some great videos and lots of good stuff that's up for the library people on the Niche Academy, and you can see that stuff up there as well. So, Ryan, you're a good friend, and I always am so proud of the work that you do and the things that you're all about in terms of what you've been doing for Hesed House for 30 plus years. So thanks for coming on the show, my friend. I appreciate it.
Thanks, Steve.
Take care, brother. Thank you.
Bye-bye.
So thanks for listening to this episode of Crime Time. I encourage you to go to my website at crimetimeradio.com. Send me an email with questions or topics you want me to cover on future shows. You can connect with me on LinkedIn. You can certainly follow me on Twitter at Dr. Steve Albrecht. If you're a Twitter person, Twitter's hopping today on the election day, so don't forget to vote. Next week's show, we'll be talking to Dave Fowler. Dave's from Idaho. He has a company called PersonalSafetyTraining.com. He teaches self-defense for people in government and private sector, casinos, hospitals, hotels on dealing with dangerous people. So we'll be talking to Dave Fowler about the work that he does. In our world, there are sheep and shepherds and wolves. Too many people are sheep and too few people are shepherds. There are lots of wolves out there. There are not enough police officers or sheriff's deputies to protect us all, so you need to be a shepherd. Take care of yourself and your family. Protect your loved ones, your friends, your co-workers. Pay attention. Be prepared to defend yourself with legal force if necessary. Be a good witness for the police if you see a crime. Stay safe and aware and alert at home, at work, at school, and even on the road. Thanks for listening to Crime Time. My thanks to Jim Whining, producer Matt, and all the good folks at Axe Media Group. I'm Steve Albrecht, and thanks for listening to What I Know Is